Hi, my name's Stephan from Greenville, South Carolina, Steadman Hawkins Clinic, part of Prisma Health. I'm excited to talk to you about rotator cuff augmentation with BioBrace with a case example. We're often faced with a dilemma as shoulder surgeons because standard repairs can be effective. However, I think we've all had patients we wish things had gone a little bit better. Re-tears are still a problem with up to 30 to 40% in the literature showing re-tears. This can lead to tear propagation, muscle death, unhappy patients, and any subsequent surgery to help those patients can be very unpredictable. If we study patients long enough, I think we'd all agree as well that patients do better with a successful repair. Better strength, happier patients, better long-term outcomes. The question becomes when to augment. This is a hot topic in many of our debates. This recent meta-analysis did show a significant reduction in re-tears when a graft was applied to the rotator cuff. And the current literature would support the use of these to help reduce re-tears and improve outcomes. Well, we have to remember that there's a muscle on the far side of that tendon. The muscle still must be healthy in order to have a successful repair. So what we're talking about here is if the muscle's healthy and the tendon is also healthy, perhaps a standard repair will work. If there's bad tendon, then perhaps we need to augment the repair. But the question of the day is, what constitutes a bad tendon? There are probably both preoperative and intraoperative findings that can portend a tendon that would not want to heal. There may also be host factors, patients that have medical problems that are going to lead to poor healing. And these are the tendons we need to be on the lookout for. This group tried to quantify that by coming up with a scale that looks at negative prognostic factors that in their series led to poor healing. And it's staggering that as these negative prognostic signs increase, so do the failure rates. Well, what is BioBrace? BioBrace is comprised of two materials. There's PLLA, which provides supplemental strength for 2 years before naturally resorbing, and type 1 highly purified collagen to allow for biologic support. It's highly permeable, 80% porous, allowing cells to infiltrate. And this has been shown by 6 weeks to thicken the tendon and just as early as 12 weeks to be as strong as a native tendon. It's very strong even in an aqueous environment. It's important to remember about stress shielding. If the scaffold is too stiff, it may stress shield the tendon and not allow for natural healing. If it has insufficient strength, it may not provide the appropriate support. So I took the information gathered from this preclinical work and applied it to my patient. This is a 63-year-old female who had fallen 8 months previous, and these missed tears can often be problematic to get to heal. You can see that the muscle's still healthy on the sagittal MRI, and she did not have any degenerative changes, but her ROHI score calculated was 7, which made for an unacceptably high failure rate. At the time of her surgery, she had a healthy joint, but a very large retracted tear, and these are the ones that I worry about healing. So this video from her surgery shows how the scaffold is introduced into the joint. Sutures are grasped with a standard passer and shuttled through the scaffold. A standard knot is tied such that it can be helped to introduce the scaffold into the joint. The other limbs are pulled and the scaffold is introduced into the joint to rest onto the tendon repair. And this is the final construct showing the BioBrace on top of the repair and compressed by the rotator cuff sutures. Now with the release of BioBrace RC, this process has been made a whole lot simpler. Simply grabbing any 4 limbs and shuttling it through the BioBrace RC makes suture management so much easier. The insertion tool will allow passage of the scaffold into its final resting point, and standard arthroscopic knots can be tied at the medial corners. Then standard lateral anchors can be used to fixate the lateral margins of your scaffold for a final construct that looks like this. I've been amazed in how patients such as this can do well even early on, and this is our 3-month follow-up showing restoration of good range of motion, a happy patient, and she's ready to start the strengthening phase of her rehabilitation. Thank you.